Hi, I'm Shweta. I'm the director of Mind Reader. Welcome to the podcast. We are here with Mari Kibblewhite, and we are going to discuss an interesting topic as usual. And today's topic is hypnotherapy. Hi, Mari. How are you doing?
Very well, thank you, Sweta. Thank you for inviting me again.
Yeah.
Always interesting.
Yeah, I've been to doctor and it was interesting to know how you are dealing with the problems right now. So related to that question, in your experience, what are the main ways of dealing with health problems nowadays? Like what's your experience on this?
It's an interesting question you ask. I think looking back, I would categorize four main health protection systems. I will use those terminology. First one would be the Western system that we have at the moment, which you go to your doctor and you get given pills normally, and that's all you're given, and advice, of course. Second group is what the traditional medicines that have been especially in the long-standing countries like India, where you're from, and China, and the Indian one is called Ayurveda, and they've got a lot of specialized techniques. I don't know enough about it to talk about it, but I'm just saying that it's a separate systems. And then there's what I call natural systems, which is having the benefits of plants. One particular one that I'm using at the moment is Moringa, Moringa, which is especially very strong, and I'm beginning to see some benefits from that. That's natural plants, and they can be leaves and roots, and these have been developed over the many, many years. And the fourth group is treatments, and the main treatment that we've been talking about comes to this category in respect of traumatic or patients that have suffered a trauma has been hypnotherapy. And I would really appreciate if you could describe history of hypnotherapy, what it's involved, how it can be used. Would you want me?
Thank you. That's a very good question, Mari. I personally believe hypnotherapy is the best therapy for mental health, behavior issues, pain management, trauma recovery, achieving specific goals, and also for an improved sleep. So, when we talk about the definition, hypnotherapy is a therapeutic technique that uses hypnosis, which is a state of deep relaxation and focused attention, to help individuals access their subconscious mind. In this state, people become more receptive to positive suggestions, enabling changes in thoughts, behaviors, and emotional patterns. It's widely used for issues like anxiety, stress, phobias, addictions, and I regularly combine hypnotherapy with the other related mental health therapies for all my clients that I work with.
Very good. You said hypnotherapy trauma. How does it work? How procedure? What? I don't fully understand how would you use hypnotherapy for removing a trauma?
Yeah, so if we talk about the origin of hypnotherapy, it goes 4,000 years back. Hypnotic like practices were part of spiritual and healing rituals in Egypt, Greece, and India. And in Egyptian sleep temples, priests induced trance states for dream interpretation and healing. In Greece, the temples of Asclepius used temple sleep where patients entered a trance like state for divine healing. And ancient texts also talk about trance states and their therapeutic potential. And then in 19th century, there came the scientific approach. James Braid coined the term hypnosis in 1841, shifting focus from mysticism to psychology. Braid defined hypnosis as a state of focused attention and heightened suggestibility, not sleep. And hypnosis began to be used for pain relief and surgery before chemical anesthesia became widespread. Now, when I talk about pain relief and surgery, most of the clients, and obviously it costs and it's not government funded, so I would say people who are financially stable, all of them use hypnotherapy for pain relief before surgery and also after surgery for quick recovery. When the females have birth, which are through C-section, they also go with these therapy sessions. But I can understand it's not affordable for everyone. But there are hypnotherapists working in hospitals with the clients with the permission and in a very safe way to help proceed with the surgeries and the recovery of the surgery. And there are a lot of hypnotherapists working with cancer patients as well to keep them going and helping them adjust in their difficult times. So it is currently happening, and my teacher who trained me to be a qualified hypnotherapist is Miss Casfield Anderson. She's based in Queensland, Australia, and I'm really proud to study this with her because this is the third generation where her family is passing on this information to everyone. And I was the last batch which she taught as a hypnotherapist teacher. So I'm lucky in that way. And I have learned neuro linguistic programming, which is called NLP from Mr. Gordon Young at IIP. So I've been really lucky to have these great teachers teaching me these practices. And when Mari, your question was about the hypnotherapy methods, like there are different methods for different situations. Like it will be different for addictions, it will be different for pain management, surgery, for having a better sleep, it will be a different therapy again. So
Thank you, Shweta. That's very, very interesting. A lot of detail there. I'd like us to continue on at another time, please, because I've got some other questions I want to discuss. So I look forward to meeting up with you again soon.